Good morning, Chicago. Today is Tuesday, February 16, 2021. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And per usual, this is your opportunity to get your COVID questions answered directly. As always, you can put your questions into the box below, or you can use the hashtag AskDrArwady on either Facebook or Twitter, and we'll be getting to your questions live. We've already had a lot of questions coming in, and I've put together just a few slides that will help address some of the questions that we're getting the most, and then we'll move into live questions. But first, let's take a quick look at our data, which looks so good. So as always, chicago.gov/coronavirus. That's your one-stop shop for all things COVID. And if you go to the dashboard, as you can see, if we got it pulled up, so look at that positivity rate, 3.6%. That is our 7-day rolling average. You can see a week ago we were at 4.9%. That is the lowest test positivity rate the city of Chicago has seen since our COVID outbreak started. Even over the summer, the lowest that we'd gotten down to was 3.7%. Now, some of the reason that positivity is looking good is that we really have good testing access here. And that's one of the reasons we don't just look at test positivity. We always look at test positivity and cases together. But if you look at our cases overall, you can see that that too is looking really good. Obviously, we've had a holiday weekend, we've had a lot of snowstorm. Even as the testing is falling off a little bit, it's a good sign the positivity is staying low. But our daily cases here are the part I'm even happier about. 344 new cases per day. Again, that's our 7-day rolling average. You can see down from 501 a week ago. And if you've been following, that helps get us into this moderate risk category. So I'm going to actually switch because some of the questions we were getting about risk level and what's happening with this. So I'm going to go ahead and pull up here just a couple of slides so to look at that same data and see where we are. So this is available online, and again, this is really looking at the 4 indicators that we've seen here in Chicago are the most important indicators that we track looking for any signs of trouble. Obviously, we have some cases of variants, although our numbers look good, and part of that is because we've been pushing vaccine into the parts of the city where we most need to get it, so I'm really pleased. We still have a ways to go, and so if you look at this matrix here, you'll see that our COVID cases diagnosed per day now at 344 is in that moderate risk category. It's down out of high risk. That means we're less than 400 cases per day. Given that we've now been there for 3 days, and you can see that all of the indicators, the test positivity is actually in lower risk, our emergency department visits, our ICU beds are all in that moderate risk category. We now are at a point where we can again turn that dial and make some more cautious and careful reopening. So we will be expanding restaurant capacity, indoor restaurant capacity from 25% to 40%. And the Department of Business Affairs and Consumer Protection will be sending out some of the details related to that. If we can hold in this moderate risk category for all 4 of those indicators or below, even see them get into lower risk. You can see our emergency department visits are getting close to that lower risk. Even our ICU beds really getting closer to that lower risk. As long as we can hold all 4 of those indicators in moderate or lower risk for another incubation period, we'll be able to do even some further careful expansion. For example, bringing the restaurant capacity to 50% as long as they can keep that 6-foot distance and additional pieces. So everything's looking really good on that front. One question we were getting a lot of was related to some of the new CDC guidance, excuse me, that came out. And cdc.gov is where I'd refer you if you want to see the details. Really pleased about this. They did a nice job pulling together all of the data, which there has been a lot of data, as you know, related to school reopening, really highlighting that K-12 schools should be our last settings to close after all other mitigation measures are employed and the first to reopen when they can do safely. And there is a chart in there. This is really the bottom line. I know Chicago Public Schools, I believe, is also sending out some additional information. And I think a letter from me highlighting how this fits in. But what we were pleased to see here is that after looking at national data, international data, including data here in Chicago, what the CDC has really recommended that, of course, all schools, you need to have that universal and correct use of masks. You need to have the key mitigation strategies like hand washing and contact tracing. But they really have noted that even at the highest levels of transmission, see that if you're in a high transmission red, really elementary schools they're recommending should be open in a hybrid mode, meaning with all the mitigation things that are in place, the physical distancing, the masking, the pods, the limiting the numbers. And you can see really moving down that is, that remains an indication, and that middle and high schools really in moving toward hybrid learning as you get toward the substantial transmission. But then especially, if you are open, you shouldn't close. And as long as you have the mitigation strategies in place in few cases, even those middle and high schools, they recommend open at that highest transmission. So this is good news where we're again looking at Chicago. We have seen our private and parochial schools be open successfully without being significant sources of spread of COVID, even at relatively high risks of transmission. And obviously, as CPS is coming back, we were really pleased to see this be followed up. So in terms of where does Chicago fall, we got some questions about that too. So the Chicago falls at the low transmission for positivity, that blue. We're at 3.6%, and I help sort of match this up. You see on the top row here, CDC has defined less than a 5% positivity as being in a low transmission or a blue state. And then one of the questions we got was about how CDC was defining the case numbers. And they use this new cases per 100,000 per 7 days. It's really normal to use the per 100,000 to compare across different jurisdictions. And so you can see high transmission here is 100 plus cases per 100,000 per 7 days. We're more used to here and really around the country at talking about it as per 100,000 per day. So you divide 100 by 7 and you basically get to about this 15 per 100,000, which, right, that's the same indicator that we use for the travel guidance, for example, the high risk status. And that works out to approximately 400 cases per day. So we are at this substantial transmission point here using the CDC cutoff, really the same as what we're seeing using our regular city metrics. So everything really on track there and no surprises, but really good to see the CDC making those same recommendations that we were making here. I also just wanted to highlight lots and lots of questions about vaccine supply. And I want people to understand that we are getting some small increases in our vaccine supply. We're really pleased about that. Every dose of vaccine, of course, means that we are making progress against COVID, but the increase has been really small. And so I shared this last week, but I think it bears repeating. That green circle shows you the Chicago residents who are eligible for vaccine in Group 1B. We have more than 360,000 Chicago residents who are 65 or older, and we have 350,000 Chicago residents who are in those eligible frontline essential worker groups. So that's more than 700,000 folks right there, not including the non-Chicago residents who work in our high-risk settings in Chicago, and not including the healthcare workers who became eligible in 1A and are now deciding to get vaccine. So although we've got more than 700,000 people who need vaccine, we're still getting less than 5% of what we need to cover that group. And so each of these four little slices of the pie represent how many first doses Chicago got each of the last 4 weeks. And you can see we went from just under 5,000 first doses a day up to this last week, 6,000 first doses per day. Improvement for sure, but 6,000 first doses a day compared to how many people need to be vaccinated is still really small. And where we look at this current week, it does go up again a little bit. Pleased to see that. We expect 6,900 first doses per day. There is a new federal retail pharmacy program you might have heard about. We in Chicago were already directing some vaccine to pharmacies, but this is additional federal allotments, which we're very pleased about. Anytime there's more vaccine, that's the most important thing. So Walgreens is getting another 4,250 first doses for the whole week, right? You got to divide that by 7 days to see per day. We didn't see a change in our Pfizer doses, and we saw, again, a small increase in Moderna, up 2,000 for the week. So in that that context, we're getting 48,300 first doses for the week, or 6,900 first doses per day. 1 in 10 Chicagoans have now gotten at least a first dose of vaccine. That's really exciting. 1 in 5 and almost 1 in 4 Chicagoans, 65 plus, have gotten at least that first dose of vaccine. And you can see the biggest increases have been in those over 70 and over 80. So that's really good news. We're meeting all of our efficiency goals. Every week we have managed to push out at least 95% of the vaccine to providers. Right now we're at 96% of Chicago's allocated doses have been pushed out. We are holding just a little bit to make sure that we're meeting all of those second dose requirements, but the planning has been good around that. So we're meeting that goal. And then really exciting, the other efficiency goal that we were aiming for was this, the ability to show that vaccine is in arms, that it's been administered and reported. And if we set aside the vaccine that's held for the long-term care facility program, which again is running January, February, March, but has had doses allocated, setting that program aside, 100% of Chicago's allocated doses have now been administered and reported 7 days after delivery. That's really exciting. It lets us know that this network that we've built, we've got more than 500 providers ready and able to receive vaccine. It lets us know that we are not having any vaccine sitting on shelves. Again, our goal here was 85%. And you can see each of that blue line there is our vaccine that's been delivered, and we lag it by 7 days, and then the green line is the number that have been reported administered. So that's a really exciting goal. And even including the long-term care facility doses, we're now at 86% administered and reported 7 days after delivery, again meeting our goal. We are seeing much more of our vaccine being administered from outpatient providers. Remember, the number one way people are getting vaccinated, especially people over 65, is for their provider calling them in for an appointment, not them having to navigate, the ZocDoc or any of the websites, because we know especially older Chicagoans may not be as connected online. So this has been really good to see. And again, our volume of administration is increasing in outpatient settings. So we just need more vaccine. Our efficiency looks really good. We'll be sharing more equity data later in the week. That also looks really good. And just needing some more doses. So with that, let's turn to your questions. Okay. Many questions related to delays in vaccine shipments due to the weather and how is this impacting the city. We've got a question, what should people with appointments do and how long might this last? Yeah, really, really important questions, and we've already been answering them. So for any of you not sitting right here in Chicago, we've just had an enormous snowstorm really dump between as much as 1.5 feet of snow at Midway. And in that context, our vaccine shipments to Chicago have been delayed. So to the point that I just made, that we are literally putting 100% of our vaccine into arms within the week, we don't have vaccine just sitting. We receive every week our allotment. It typically comes into the cities Mondays, Tuesdays, and Wednesdays. Between Monday being the federal holiday and then, unfortunately, this really large snowstorm, most of our vaccine comes on trucks from Tennessee. And we are not getting the vaccine. We didn't get the vaccine that we were expecting. There's more than 100 providers that didn't get their vaccine like we were hoping today, and we just need to wait for that vaccine to get here. I want to really emphasize 2 things. One is that in the city of Chicago pods, where people were scheduled for appointments today, we are rescheduling those appointments. So you do not need to get back online and try to fight and find another appointment. You will be rescheduled for that vaccine. It was a mix of first and second doses. So we will be working to make sure that those second slot people get put in. Not an issue for you to get your second dose, up to a week or so later, and we'll be getting the first dose in. We will absolutely get everybody in within 2 weeks. I expect we'll actually get most people in within 1 week. We'll probably add some additional vaccine clinics to make sure that will happen. So if you had an appointment at a City of Chicago vaccine site today, you already will have gotten an email that that is being rescheduled and you don't need to do anything else. It will be rescheduled. If you have a vaccine appointment at another provider, many providers are also needing to reschedule their patients. There are some, if they already had vaccine, that are moving ahead, including some of our Protect Chicago Plus communities. So I would just encourage you to, if you had that appointment, to reach out. We've really encouraged providers to do that outreach proactively, but before you travel out in this snow, which it's very hard for people to be getting out of driveways and down streets right now, make sure that site is operating. We can control a lot of things, but we can't control the weather. I do want you to know, though, that all of this vaccine has all of the appropriate cold storage. So even if it takes another day or 2 or even 3 for that vaccine to get here, it's got the right dry ice, it's got the right temperature tracking. There will not be vaccine wasted, and there will not be vaccine wasted at any City of Chicago site. So please rest assured on that. I'm hopeful that we'll see it come through in the next day or 2. We certainly will be alerting our providers as we get more information. But particularly in the South, they're not used to handling large weather events like this. And as vaccine gets here, we will work to get it out. All of the City of Chicago sites are indoors, but without vaccine, obviously we can't have people coming if we don't have vaccine to put in arms. So I would expect over the next couple of days that will open up, and we'll certainly share more. But rest assured, if you had an appointment, it will be rescheduled. You don't need to do anything. Okay. Matt Lyman is asking, can someone from Will County get the vaccine in Chicago, or do they have to go through their county? You should be going through your county to get vaccine. We make some exceptions for people who work in the city where we are doing employer-based vaccination. So for example, if you live in Will County, but you work in one of the work settings where we've seen a lot of outbreaks, where, bringing vaccine into some of these workplace settings, we wouldn't say to you, no, you can't get vaccine because you live elsewhere. But if you are trying to get vaccine sort of through a City of Chicago pod, through ZocDoc, through pharmacies, et cetera, you need to be getting vaccine in the county where you live. And we've been working to really think about our practices there, because we have seen people, unfortunately, and I'm not saying, this is a very legitimate question. This isn't I appreciate that people are asking this, but we have seen some people, trying to not always be truthful, and we are working to think some more about, without requiring formal identification, how do we really work to make sure that vaccine is being prioritized for Chicago residents, especially in those non-employment type settings. Lee Barenbaum is asking, I'm 63 with underlying conditions. How and when can I get my shots? So this has to do with when we are able to get more vaccine. Right now, again, with the amount of vaccine that we're having, we are still open to people who are 65 and over, and pushing it into the settings that have really been driving our COVID outbreak. So we've been working to push vaccine into some of our highest risk communities and dedicating vaccine there. We've also been working to get vaccine. We started with, for example, the correctional officers in the jail, the first responders. There is some vaccine that is being dedicated to educators. But again, in all of these settings, we are balancing, and we couldn't just say all educators can get vaccine, all people in these settings. And this is going to be really extending over, again, we expect February and likely most of March. When we have significantly more vaccine, we will be then expanding to people who have those underlying conditions. But we really, in Chicago, as you know, projected that would likely be at the end of March. If we get lucky and we end up getting significantly more vaccine from the federal government, if we get more vaccine directed from the state, whenever we have enough vaccine that we can actually expand that, we will. But we're not talking forever here. We're talking sort of on the order of a couple of months to when we'll probably be able to expand to folks in that 1C category. Okay, D. Sanders. I've had my second dose and I'm anxious to see my 9 and 10-year-old grandkids. Must they wear masks along with me? Hugs or still social distancing? So, right. So this is where we're at this point where although we're making really good progress on vaccine, right? 10% have now gotten at least that first dose. We're still only at about between 3 and 4% have gotten both of those doses. We actually, where we think about that 95% protection, we think about 2 weeks post the 2 doses. So just to kind of answer that part of the question. And children can't get vaccinated yet. And they're not going to be able to be vaccinated, I would guess, until the summer at the earliest. And these younger children, it may even be later in the summer, possibly even fall, not because there won't be vaccine, but because we have to make sure that all of the safety and efficacy trials are done, so that when we're making recommendations, children may need a different dose, for example, of COVID vaccine. We have to make sure those studies are done. And although the studies are now being done, they're being done for adolescents, really those 12 to 17-year-olds. And then after that, will probably come for those younger kids. So I would still be recommending that if these are not people that you are otherwise in your bubble, that you do continue to do that masking and the social distancing. It's obviously much, much safer for you at this point with that 95% protection. But right now, we are still recommending, and this is true really across the board, that if you are gathering, even if you've been vaccinating, you still are using those extra layers of mitigation. As we see our COVID numbers come further and further down, as we see our vaccine numbers go further and further up, I do expect we'll be able to make adjustments to that. And everybody's going to make the decisions that they make. But really the ask right now is to keep doing those mitigation practices. So good question. Christine O'Hara, can you get the vaccine if you are allergic to penicillin? Yes. So the recommendations related to allergies, again, where we have seen any concern related to allergies, it's been where people have an allergy to a component of the COVID vaccine. We've not seen issues with allergies related to penicillin or to any other oral medications that you would take by mouth. We've not seen issues related to food allergies. We've not seen issues with people who have allergies to bee stings or to environmental, grass or whatever else. Where we've asked people to really have that conversation, first, if you have a really significant history, right? An anaphylaxis, you carry an EpiPen, you still can get the vaccine, but we monitor you for 30 minutes and have that conversation with your allergist if you have questions about it. In addition, if you have had an allergy to an injectable medication, that's when you should be having, like a serious allergy, you should be having a conversation with your doctor. Still, generally, the recommendation is that you go ahead with getting the vaccine. Again, we would do some monitoring there. But for the great majority of people who have allergies, penicillin is actually the most common oral medication allergy. We've not seen any issues with people getting the vaccine with that allergy. So really good question. I'm always a little bit, I want people with histories of severe allergies talking to their allergist, talking to their doctor on the individual level. But certainly for the great majority of people, we've not seen issues. And we do have protocols in place where if anybody were to have an allergic reaction, we have medication on the spot. We have protocols, but generally you can go ahead and get the COVID vaccine. Eve Greenfield, what if we live in Chicago, but our health care has all been in the suburbs? Can we be vaccinated where our health care providers are if we can get an appointment? So the bottom line is you can get a vaccine where you can get an appointment. What we have been encouraging our Chicago providers to do is to first prioritize people who live in Chicago. Like I said, people who work in Chicago are also eligible, but most of that is really happening where we've got dedicated employer-based vaccination happening. And we have said that people who get their ongoing medical care in Chicago can also be vaccinated through their provider. But that means like your regular doctor. So for example, we know that there are providers who are right on that border of Chicago Cook who are going to see both of those. It's fine if you're getting your vaccine through your regular provider and vice versa. Our goal is to really make sure that everybody over 65 can get vaccinated. Of course, our first priority is Chicago residents, but what we don't want is people coming in who don't have a connection to Chicago. We want you to get vaccine where you live. And if you get vaccine in a suburban Cook, if you get vaccinated, on purpose, we've got a lot of back and forth. 38% of Chicago's vaccine has been going to non-Chicago residents. So I don't want to imply that we've said, absolutely no one can, but we want that to be people for whom it's most appropriate. And we are tightening up a little bit that Chicago residency part, particularly through pharmacies and at our pod. But the best place to get a vaccine for anybody is through their healthcare provider. And, we've also been having conversations really with the state. Chicago gets its vaccine directly from the federal government, but Cook County, Lake County, DuPage County all do get vaccine allocated from the state. And we do think it's important to push additional vaccine, as it becomes available to this most populous part of Chicago. And we're having a lot of conversations, really across with the state, with the counties. Our goal is to make it as easy as possible for people to get vaccine in the way that it's been prioritized. Kathy Slatterly Keith on Facebook. The new J&J vaccine seems to have efficacy numbers that are lower than Pfizer and Moderna. Are the numbers comparable? Okay, so we will definitely be talking more about the J&J vaccine after the data has all been looked at. It still has not gotten that emergency use authorization from the FDA. The meeting is February 26th for the advisory group there. And that will be public. You can watch it. We'll certainly be watching it and looking at all the data where we look in great detail about everything that was done in these trials. Based on what we've seen in the media, what it's looking like is that, so the Moderna and the Pfizer, they're about 50% protective after the first dose, and then about 95% protective after the second dose. What we're seeing preliminarily is that Johnson & Johnson vaccine is like in the 70% protection range after a single dose. So it's actually maybe more protective than either the Moderna or the Pfizer after the first. We don't have yet the recommendation for which group this will be recommended for. Remember, after the FDA makes its recommendation, the CDC, through the Advisory Committee on Immunization Practices, makes its recommendation. And it may be that they, I'm sure they'll give some latitude, but this may be, for example, a vaccine that we think about giving to younger essential workers, for example. And we may think about using the Pfizer and Moderna more for those even higher risk older folks. But I don't know yet, because we've not yet been able to see that data and we've not gotten the formal recommendations. The big news on this, though, think about why do we vaccinate, right? Why do we vaccinate against polio? Why do we vaccinate against measles? Why do we vaccinate about COVID? It's not really to prevent sort of mild cases of the sniffles. It's to prevent serious cases. It's to prevent hospitalization and to prevent death. And the good news is that all the vaccines, like every one of them, including the ones that have not been in use here in the US, have had fantastic efficacy against these severe outcomes, against hospitalization, against death. And that includes the J&J vaccine. So if this vaccine gets approved and we have it available, I will be thrilled to have a third vaccine that will significantly increase our supply, because it is protective against COVID. It is protective against the severe outcomes. And that's actually really good efficacy for a vaccine. It's better than our flu vaccine is often every year because of the different strains and variants. So more will be coming about that, but I see it as good news really all the way around, and we'll be sharing more once we actually have the chance. We always look at the specific data before we make recommendations with all of our local experts here in Chicago. Okay. Mike Chinander, what's the current limiting factor on how many vaccine doses can be given in Chicago? How much vaccine we receive. We're putting 100% of our doses into arms within a week. Literally the thing holding us back is vaccine production. The Biden administration has put a lot of resources into increasing how much Pfizer and Moderna is being made. And if you're interested, last week, I believe, I shared in a lot of detail where we are on J&J, which is the one that is being considered and I think is likely to get that emergency use authorization. And we may see it here in Chicago as soon as early March. And then the AstraZeneca and the Novavax are two that are a little further back that, the trials are still ongoing. It would be premature. We've got to see good safety and efficacy data before we're confident. But we're going to get more vaccine. Everybody's going to be able to get a vaccine in Chicago. I'm really feeling good about being able to say that, I think probably by this summer. And so we're talking about, continuing to ramp up in March as hopefully vaccine grows. And then I think significantly more growth of vaccine in April and May. And I'm feeling confident that really by the summer, there's going to be enough vaccine for everybody who wants one. And then second part of Mike Chinender's question, various vaccine trackers say that Illinois has administered about 55% of the dose delivered, where are those other 45% saving for second doses? So again, I really have insight into Chicago's data. I can tell you that some of this, because I've been looking a lot at different vaccine trackers, the latest data I saw for Illinois was actually quite a bit higher than that, but a lot would have to do with second doses. It would also probably have to do with the time that you're actually looking at this data. So you might have noticed that really the standard is to look at this. Like if we receive vaccine, like today, right? It's cold, the vaccine didn't get here. Chicago has been allocated vaccine, but we haven't even received it. So you wouldn't want to start saying, you know, why is all of that vaccine not in arms when it's not even received? We've really set this standard at looking 7 days later. All the vaccine has come in. Have you used all of it? 7 days later. And that's really the standard. Now that we're sort of hitting that goal, you know, maybe we'll get to a point where it's 3 days later. And so depending on whether you're actually looking in time, if you look on a Monday, Tuesday, Wednesday, all the vaccine comes in Monday, Tuesday, Wednesday. So it's going to look like there's more vaccine available. If you look at it in that Saturday, Sunday, you've literally then used up all your vaccine for that last week. Your numbers are really low. So a lot of this varies over the week. And just like for cases of COVID, for positivity, we sort of do some averaging over a 7 days. We also lag the data a little bit, knowing that when vaccine goes in arms, providers have 24 and in some cases 72 hours to actually report that in. So there is just a little bit of a lag there, and those would be some of the reasons. But I can tell you here in Chicago, again, we're putting it in just as fast as we get it. And I know Illinois has made some really excellent improvements in that regard. And that second dose is important to make sure everybody can get that second dose. We talk a lot about first doses because that's who can actually start getting vaccinated. Behind the scenes, we've got all those second doses, and we're working really hard to make sure when we say you can get your first dose, you're going to be able to get your second dose on time in the right place. And Illinois, I know, is also doing that. So that would be a big part of that explanation. Okay. So Wendy Azize is saying, when are you going to show us the elderly that received their first shot months ago so we can see what they've been going through or not going through? Give those of us who are hesitant in getting those shots a true view of what's going on. Okay, so let's kind of let's remind ourselves of where we are in time. We opened phase 1B not even a month ago. I remember this because the mayor was part of the opening of 1B. She is getting her second vaccine dose this week. We only start really considering that fully vaccinated at 2 weeks post the second dose. So although the week before that was when we started, if there were additional vaccine available, we could start expanding. We actually don't have a lot of older Chicago residents who have gotten both doses of their vaccine in our 2 weeks post that second dose, except for in our long-term care facilities, right, which started. And in those settings, we are already seeing good impact. We are seeing cases going down. We've not seen any concerns related to side effects. We've not seen any concerns, certainly related to severe problems, deaths, anything like that that's been tied to the vaccine. And let me remind you that part of the reason our COVID case numbers are getting better has to do with pushing vaccine into the settings that are highest risk, right? This is part of the strategy. And so I've seen nothing to give me any concern. In fact, I've seen nothing but good news related to how this vaccine really has been performing. But we are just getting to the point. Only 3 to 4% of Chicagoans have even gotten that second dose just because of time. The great majority of them are healthcare workers, plus a few in that long-term care. We'll be seeing really more of that impact over the months to come. So I hope that's reassuring to you. And again, really patience. is all I can ask. As vaccine gets here, as more vaccine gets pushed to Northeast Illinois, there will be more opportunities. We're working hard, and I actually feel good about the strategies that we have in place. We're making sure people are getting their first and their second. We're making sure the safety's good. We're pushing vaccine out just as quickly as it can get here. We are at, like I said, 1 in 5 now Chicago residents over 65. I think we'll hit 1 in 4 within the week when our vaccine gets here with the weather, and we'll keep moving from there. So thanks for tuning in. If we didn't get to your question, we continue to update the website every day, chi.gov/COVIDVax, with additional questions and answers. We'll be doing more of the behind the science a little later this week. And I know there will also be some press conferences and some events. Really lots of good things happening here. And we'll be sharing additional data a little bit later in the week. So thanks for tuning in. I think just as a reminder, in the snow and good news, I do want to give a thanks to our departments of streets and sanitation, as well as our Chicago Transit Authority bus and train operators who've been keeping our city moving. Warming centers are still open and available. If you or anyone you know needs access to heat, to a place to stay safe in this weather, call 311 and we will get you hooked up with that. Thanks very much. We'll be back on Thursday.